Welcome to Health Sciences, Placement, Fit, and Mental Wellness, brought to you by the Hallman Mental Health Project. As we move through our program, we will have several work-integrated learning experiences that will teach us a great deal about this profession. One of the things we might learn is whether this program is right for us or if some aspects of it fit better than others. Given the importance of these questions, how can we set ourselves up for the best possible learning experience? The goal of this video is to share the types of stressors that we as students typically face during our placements. Prior to starting at a placement, there are a few required documents and processes that we need to complete. Many of us may delay in submitting these documents, which can cause a lot of stress as they are crucial in allowing us to move forward in our program. Taking care of these early on can help us to reduce stress and ensure that we are starting off our placement in the right frame of mind. While at placement, there are lots of opportunities to learn new skills and experiences that will help us to explore how we might fit into this profession. Thinking about the feasibility and fit of the placement and the profession is an important consideration for us as we move forward. First, feasibility consists of practical considerations and may include the time that will be required to do well. Some programs have courses running at the same time as your placement. Fulfilling these requirements in addition to maintaining employment may simply not be possible. Consider how much time you'll need to do things well and get the most out of your placement opportunity. The location of the placement is also a factor. Can you get to where you need to be, and can you do it consistently and reliably? Finally, placement provides the opportunity to determine if you have the capacity and desire to do all of the things that will be required in the positions that you are being trained for upon graduation. Depending on your placement, this could include working long hours on your feet, working with people who are injured or dying, managing intense situations, and working with diverse populations who have diverse needs that may be different from those that you are accustomed to. Use your placement as an opportunity to ask yourself if you will be able to manage all aspects of this potential position day to day. When we talk about fit, we are seeking to understand how we see ourselves as professionals in this field. We want to consider the culture of the profession. In a career in health sciences, you'll be responsible for the care of another human being, and you may be working within diverse environments that might be subject to variability and sudden changes in the process and procedure. The enjoyment and fulfillment that you may get from placement and subsequent position of employment. Work-integrated learning opportunities provide you the opportunity to shift your perspective from student to support person. The foundational experience that you will receive by completing your placement. For example, you will likely be introduced to a variety of different situations, philosophies, and methods of communicating and providing feedback. The typical financial compensation of the positions you might obtain with this credential. Also, consider the hours and shifts that you may need to work once employed. And finally, the opportunities for continued growth and development. Awareness of typical stressors and considerations of feasibility and fit can help us manage and improve the quality of our placement experiences. If you would like to discuss these considerations further, visit Conestoga's Career Hub or speak with our professors about questions that may develop as you approach your work-integrated learning experience. We hope you enjoyed today's video. Stay tuned for more educational videos by the Hallman Mental Health Project.